Hello, how are you? Today, we're going to talk about a problem that millions of people suffer from every day, although many don't mention it out of embarrassment or because they think it's just something aesthetic. I'm talking about varicose veins. Those veins that become visible on the legs that sometimes hurt, swell, or feel heavy, especially at the end of the day. And let me tell you something. Varicose veins are not just a matter of appearance. They are a sign that your venous circulation isn't working as it should. The good news is that there are natural, simple, and effective ways to improve this condition, relieve discomfort, and even prevent it from getting worse. So stay until the end, because I'm going to share daily habits, natural remedies, and practical tips that can help you a lot. And remember, this is for educational and wellness purposes only. It does not replace a medical consultation. If you have severe pain, intense swelling, or notice warmth and redness, you should see your doctor. Before you begin, don't forget to like, subscribe, and comment where you're watching. Remember to subscribe to receive more natural health tips and share your thoughts in the comments. It's always a pleasure to see the reach of our community. What are varicose veins, really? Imagine your veins as little tubes with valves that open and close, allowing blood to flow upward from your legs to your heart. When those valves weaken or get damaged, the blood doesn't rise completely and tends to accumulate in the leg. That buildup increases pressure, and the vein dilates. That's how varicose veins appear. They look like blue, purple, or bulging veins under the skin, usually on the calves and thighs. But besides being visible, they can cause pain, burning, cramps, a feeling of heaviness, or itching. Sometimes the skin even darkens or becomes more sensitive to touch. The most common causes are several. Genetics play an important role, as well as age, a sedentary lifestyle, being overweight, pregnancy, and spending too much time standing or sitting without moving. In women, hormones also play a big role. That's why they often appear during pregnancy or menopause. Although many people ignore them or cover them with clothing, varicose veins can seriously affect quality of life. If untreated, over time, they can lead to chronic swelling, inflammation, and in more serious cases, ulcers or clots. So talking about them and treating them in time means taking care of your health, not just your appearance. What treatments exist? The first step is always self-care. Walking, moving your legs, wearing compression stockings, and maintaining a healthy weight can make a big difference. Compression stockings, for example, are a very powerful tool. They're not just for older people. They're designed to apply gentle pressure that pushes the blood upward, helping the valves work better. You put them on in the morning, when your legs aren't swollen yet, and wear them throughout the day. When varicose veins are already very pronounced or cause constant pain, doctors may recommend more specific treatments. One of them is sclerotherapy, where a substance is injected into the vein to seal it so that the body reabsorbs it. There are also laser or radiofrequency treatments, which close damaged veins using controlled heat. They're outpatient, quick, and effective procedures. In more advanced cases, a minor surgery may be needed, but the results are generally very good. However, even after a medical treatment, daily habits remain the foundation. Because if you don't take care of your circulation, new varicose veins can appear over time. How to prevent and relieve them naturally. Now let's talk about what you can actually do at home every day without complications. The first thing is to move your legs. Walking, swimming, or cycling are ideal exercises because they stimulate the so-called muscle pump of the calf. That pump is literally the engine that pushes blood upward. A simple exercise you can do anywhere is this. Stand with your feet hip-width apart. Slowly lift your heels until you're standing on your toes. Hold for a second and lower down slowly. Repeat 15 to 20 times, 2 or 3 times a day. It seems simple, but it activates circulation and strengthens veins deeply. Avoid spending long hours in the same position. If you work sitting, stand up every 45 minutes, walk a bit, or make ankle circles. If you work standing, find moments to move your legs or rest them on something slightly elevated. The human body was not made to stay still. Elevate your legs every day. This is one of the most powerful and easiest habits to do. You only need a cushion or pillow. Lie down and elevate your legs so that they're slightly above heart level. Do this for 10 to 15 minutes at the end of the day or whenever you feel heaviness. That simple position allows the accumulated blood to return to the heart, reducing swelling and fatigue. It's almost like giving your veins a break after the whole day. Nutrition for good circulation. What you eat also has a huge impact on your vein health. A diet rich in fruits, vegetables, fiber, and antioxidants helps keep the walls of your blood vessels strong and flexible. For example, foods high in vitamin C, like oranges, strawberries, or kiwi, stimulate collagen production, which is essential to keep veins firm. Potassium, found in bananas, avocados, lentils, or almonds, helps eliminate excess fluid and reduce pressure inside the veins. And fiber, found in oats, chia, or leafy greens, prevents constipation, which often worsens varicose veins because it increases abdominal pressure. On the other hand, it's best to reduce salt, processed foods, and refined sugars. Salt makes the body retain fluids, and that retention ends up swelling the legs. Excess sugar promotes inflammation and weakens vascular tissues. An ideal breakfast example would be whole oats with berries, a handful of nuts, natural yogurt, and a glass of water with lemon. Clean energy, antioxidants, and nutrients that care for your veins from the inside. Plants and natural remedies. Now we enter the territory of natural allies. Some plants and extracts have been studied for their benefits on circulation and venous health. One of the best known is horse chestnut. Its extract can help reduce the feeling of heaviness, itching, and cramps. Another very effective plant is butcher's broom, which helps decrease swelling and improve venous return. Gotu kola favors collagen production and improves circulation, and vitamin C complements this action by strengthening blood vessels. You can also apply some topical home remedies. For example, horse chestnut gel or witch hazel water help soothe burning and refresh the legs. Another popular option is apple cider vinegar. It can be applied with a cotton ball or mixed in a foot bath with warm water. This improves superficial blood flow and reduces inflammation. A nightly massage can also be very beneficial. Just mix a few drops of cypress or rosemary essential oil in a tablespoon of base oil, like almond or coconut oil, and gently massage upward from the ankles for a few minutes. That upward motion stimulates circulation, relaxes the muscles, and leaves a light feeling. If you like natural remedies, you can prepare a homemade oil with rosemary and bay leaves. Place a few fresh sprigs in 200 ml of olive oil. Heat it in a bain-marie for half an hour, strain, and store it. Apply a bit 3 times a week with a gentle massage. It's a traditional remedy that activates circulation and reduces swelling. However, avoid applying it if you have open wounds or irritations. And remember that no natural remedy replaces medical attention when needed. Weight control and proper clothing. Maintaining a healthy weight is another key factor. Excess weight increases pressure in the legs and forces the veins to work harder. Also, avoid wearing clothes that are too tight, especially around the waist or thighs, because they can compress veins and hinder blood flow. And a tip that seems small but makes a big difference. Don't cross your legs for long periods. It's a common habit, but doing it constantly partially blocks circulation. If you spend many hours sitting, use a small footrest to keep your legs elevated. And every hour, stand up, walk a bit, or do some calf raises. Your circulation will thank you. Contrast baths or cold showers. Another useful practice is alternating temperatures. During your shower, finish with a stream of warm to cold water on your legs, from the ankles up to the thighs. Do it for about 30 seconds and repeat 2 or 3 times. This stimulates the contraction of blood vessels and improves blood flow. If you do it at night, it will also help you sleep better because it relaxes and reduces the swelling accumulated during the day. 5 daily habits that make the difference. If you had to stick with only 5 things, let them be these. 1. Walk every day for at least 30 minutes and do the tiptoe exercise several times. 2. Elevate your legs for a few minutes at the end of the day or after work. 3. Take care of your diet. Less salt, more potassium, antioxidants, and fiber. 4. Do a gentle massage with natural oils to stimulate circulation. 5. Wear compression stockings if you're prone or have symptoms, and remember to take active breaks if you work long hours in the same position. These 5 simple habits, maintained consistently, can change how your legs feel. The key is not doing it one day, but doing it every day. Improvement is usually felt after 4 to 8 weeks when you notice lighter legs, less swelling, and veins becoming less visible. A common question is, can varicose veins disappear completely with natural remedies alone? The answer is, not always. Habits and natural treatments relieve symptoms, strengthen veins, and prevent new ones from appearing. But if a vein is already very dilated, it may require medical treatment. Another question, how long does it take to see results? It depends on the degree and your consistency, but most people notice visible improvement within a few weeks. Lighter legs, fewer cramps, and less swelling are signs of progress. Some people also ask if herbal supplements work. Yes, they can help, but always consult your doctor first, especially if you take anticoagulants or blood pressure medication. And something important, if you notice sudden pain, swelling in one leg, warmth, or redness, don't wait. It could be a venous thrombosis and requires immediate medical attention. During pregnancy, varicose veins may also appear. In that case, walk daily, elevate your legs, wear comfortable clothing, and consult your gynecologist before using compression stockings. Plaquer and Bricky. In summary, varicose veins are not a life sentence. They're not just an aesthetic problem, but a sign that your circulation needs attention. And most of the time, you can improve a lot with movement, nutrition, hydration, and simple habits. Take care of your legs. They carry you every day. Give them a few minutes of exercise, massage, and rest. And soon, you'll feel them lighter, stronger, and healthier. If you found this video helpful, give it a like, subscribe to the channel, and turn on the bell to receive more content about natural health and wellness. Leave me a comment. Do you already have varicose veins, or are you just trying to prevent them? Which of these habits are you going to try first? Remember, health is built every day with small steps. See you in the next video, and in the meantime, take care of your legs and keep walking toward better circulation.